MLN9708 is a new proteasome inhibitor. It is the first oral proteasome inhibitor that is being tested in the clinic. Now, proteasome inhibitors is a class of drug that is very important for treatment of multiple myeloma, both by itself and in combinations. So, the clinical trial that I am presenting this year is looking at the role of MLN9708 in a population of relapsed myeloma patients who have not had significant exposure to this class of drugs prior to the entry on this particular study. Now, this is really a follow-up study to the earlier studies that were done and presented in the past few meetings, which was the phase 1 study trying to identify the right dose of MLN9708 in the relapsed patient population. So this study kind of starts off from where that left off in terms of trying to identify the activity in a population that has not been exposed very heavily to this class of drugs. So this is a study that was done at Mayo Clinic. We took 32 patients who were enrolled on the study. These patients were pre-treated mostly with immunomodulatory drugs. About 90% of those patients had previous exposure to Revlimid, and about 60% of them were previously transplanted. So these patients were approximately 5 years out from the diagnosis on a median. And basically our approach was we would treat them with the dose of the drug that was identified in the phase 1 study, and then if we don't see a pre-specified degree of response after 2 or 4 cycles, then we would add dexamethasone to that. So there is no data so far based on what is being done in the phase 1 study as to the activity of MLN in combination with dexamethasone. So we wanted to try and answer both the questions within this context of this clinical trial.